Hi, this is Kelly from North Shore Eye Care again. I am about to go and speak with Dr. Andrew Bainnson. We're going to have a talk about sports injuries this time of year. With the weather getting nicer, it's something that definitely happens, and we see a lot of patients in our office for that. And Dr. Bainnson is one of our specialists. Thank you for taking time out of your busy day to talk to me.
You're welcome, Kelly.
So, yeah, the weather's definitely getting nicer, slowly, keeping our fingers crossed, but we definitely see patients here who have sport injuries. So do you mind just sharing a little bit about, what some of these injuries are and how we treat them?
Sure, it's a common thing, and obviously with the weather getting nicer, we do see a lot more injuries. Probably the most common things are with sports that involve balls, softball, baseball, and any of the racket sports, racquetball, handball, are especially dangerous to the eyes because those balls, and even tennis balls, when you do get struck directly in the eye, they kind of, the balls themselves will kind of squeeze and fit in between the eye socket and cause tremendous damage to the eye itself. It's something that I think we don't realize as much, that even some sports where you don't think it's going to result in injuries, we can see eye injuries, and they can be devastating not only initially, but there are also some long-term complications.
Right, so sometimes somebody comes in and they don't think much of it, and later on down the road,
yes, there oftentimes initially it doesn't seem so bad, and we'll see some signs of bleeding, for example, which can result from damage to the pupil, and that damage can result in damage to the drain part of the eye. Certainly with a more direct injury, usually the eye is filled with blood. That can take many weeks to pass. In the old days, it's not that long ago, we used to admit patients to the hospital and put them at bed rest, especially kids, because telling a kid to sit still just doesn't really happen. So you have to tie them down in the hospital and keep them from moving. But even those injuries, years and years later, can result in there's a special form of glaucoma, for example, that results after a blunt trauma to the eye.
Wow.
And really the important thing to get out to patients is that, go out, do sports, it's good to exercise, but eye protection is important. Doesn't really matter what the sport is. I recently saw someone who was a racquetball player, an older gentleman, wasn't wearing his glasses, got whacked directly in his eye, and still to this day he's still recuperating with swelling in his eyes. And you can lose an eye from an injury.
And it'll impair vision as well?
It'll definitely impair vision. Sometimes, it comes back slowly, sometimes not at all. I had one patient when I was in my training years, sort of a freak injury, but got hit with a golf ball directly to the eye. And that gentleman actually, from the force of the injury, damaged his eye that it actually had to be removed. Oh, wow. So sports are fun, but they can be something that can cause significant damage.
So what type of treatment? I mean, is there any particular protocol, or is it just different based on the injury?
It's really different based on the injury. Every patient, whether the injury seems small or large, we look hard to make sure that there's no signs of bleeding, no signs of a tear in the retina or inflammation. Because sometimes those innocuous seeming injuries that patients don't want to come into are the ones that result in the problems later on. And it doesn't have to be a big injury to cause problems. It can be a seemingly small injury.
Right.
So really the take home is if you are injured, seek care, seek some attention somewhere, and let us take a look at you. Right.
Right. At least we have very high-tech technology here staying done.
Yeah, so our technology helps us a lot because sometimes we do have trouble examining patients, or the blood keeps us from being able to see, and we're lucky in that our technology lets us get a good look at the eyes to get some sense of how bad something may be.
Right. Okay, great. Well, thank you for coming and sharing that with me and our viewers. If you would like to schedule an appointment and meet Dr. Bainnson, you can call our office at 631-265-8780. Keep in mind, we are the official eye care provider and LASIK providers for the New York Mets and the Islanders. So we hope to see you in the office soon. Thank you.
Thank you.